partners' committed effort, working long and hard to achieve this beginning steps of healthcare reform. And it's a big deal. Now, you've heard two incredible stories. What's incredible about them is they're not unusual. But I'm going to tell you one more very quickly, because I think healthcare insurance and healthcare reform is important to all of us. So my short story about how important health insurance has been to my family is that when I was newly married and when Doug and I were having our first son, we didn't have family insurance. We did not have coverage for maternity care. And what that meant is, as two young adults struggling just to be paying our bills, we had to figure out how we were going to pay for an OB and how we were going to pay for a hospital. We had to prepay for the hospital, or I can't even tell you how much it would have cost. And anything extra was a lot extra. So healthcare reform means for other people like Doug and me that they're going to be able to get the coverage, affordable coverage that they need and they deserve, and it has been far too long in coming. It's important in this legislation that we're seeing the beginning of relief from the incredible burden placed on Minnesota families by skyrocketing healthcare costs faced by Valerie and her family and so many other Minnesotans and Americans. It's important that we're eliminating those discriminatory insurance practices faced by Anne Marie and her family and so many others. It's important that we're finally closing the Medicare Part D donut hole so that our seniors can finally afford their prescription drugs. Now, we do have more to do. We have more to do, but it was important to be doing something to be helping families rather than always saying no and standing in the way of help and relief like Congresswoman Bachmann. So I'm here today to thank you and say keep up the good fight, and we're going to keep up the good fight in the Senate, and I am proud and honored to be standing with you and for you. Thank you so much.